Tell us a little bit about yourself.
Hi, my name's Claire Ryan. I've recently completed my studies at the University of Technology of Sydney, where I studied a Bachelor of Nursing.
How do you feel you've prepared yourself for the new grad transition program?
I feel I've prepared myself in various ways for the new graduate program. Firstly, I've completed my studies in classes and labs where I've learned about the various aspects of nursing. These classes have really equipped me with the various theoretical knowledge of nursing skills I would use on a day-to-day basis, such as safe practice for patients, time management of my patients and team members, communication with a multidisciplinary team, following practice guidelines, and implementing teamwork strategies I've learnt from group work assessments, appropriate care, whatever the situation, team leading, if I'm ever placed in that role, and of course professionalism through the study of law and ethics. I know from the clinical placements that I've had that I can seek help if I ever need it from other RNs and from my NUM and from other team members of the multidisciplinary team if I ever have issues or about what to expect. But I also plan to read up on hospital and nursing guidelines, policies and procedures so that I have a sound knowledge of my surroundings and my scope of practice.
What are some gaps in your knowledge you have identified?
I've also prepared myself for the transition of realizing that I won't know everything when I enter the new graduate program. And the only way that I can stay safe and to practice clinical research methods is through continual education. As a nurse, I must constantly be updating my knowledge, and as old practices become obsolete and new clinically trialled techniques are implemented, gaps I've acknowledged in myself are communicational skills, managing skills, and delegation techniques, prioritizing, learning how to be more approachable, and of course, organizing my time. I know I'll be able to do this in the new graduate program by attending in-services, completing coursework expected of a new graduate, and of course seeking assistance from clinical nurse educators and clinical nurse specialists. I'm really anxious about entering the workforce as a new graduate, but I hope that through my studies they have equipped me enough to step in the door on my first day.